Hello everyone and welcome to your Medicare newsletter. Today I wanted to cover the Medicare Part B 2023 costs as far as they're related to the Part B premium, the Part B annual deductible, the Part A hospital deductible, and of course the income related monthly adjustment amount change for your income. Let's get right into the meat of it. As I projected, Medicare is actually decreasing their premium for 2023. This is kind of where there was talks about potentially refunding portions of the 2022 premium because of that 14% increase. As you may or may not have remembered, in 2022, the premium jumped from about $149.50 to $170.10. That is one of the largest, incremental changes in the Medicare Part B premium. As you can see, this is a table brought to us by Kaiser Family Foundation. And this is the first decrease in about 10 years. The last decrease was in 2011 when the Part B premium went down by 13% from $115 down to $100. In 2022, it went up from $149 to $170, and now we're kind of back down to $164.50. It's about a little more than a 5% decrease in the Part B premium. In addition to that, the Part B annual deductible did change, and just so that you know I'm not joking, this is from the CMS newsroom. This is as of September 27, 2022. That's yesterday if you're watching this video when it's out. And it shows here Part B enrollees will have $164.90 for 2023. It's a decrease of $5.20 from 2022, and the annual deductible for all Medicare Part B beneficiaries is $226. It's a decrease from $7. So for those of you folks who are my clients on Plan N and Plan G, not only is your Part B premium going down, which is good, your annual deductible is also going down. That's good as well. So you have kind of a good news for your Medicare benefits financially anyway going into 2023. Additionally, if you do not have a Medicare supplement plan and you want one, let me know. But for those of you folks who are on Medicare Advantage, and I've probably reached out to you, I'll let you know that next year in 2023, Medicare Advantage plans did get a boost in funding from the federal government. So those private health insurance plans that are in lieu of the Medicare program, they have better benefits as well. So they're getting kind of a double bonus by having their Part B premium go down a little bit and also having kind of the Medicare Advantage plans benefits go up. As far as Part A, so Part A is interesting, as Part A is the only one here that increased. So Part A went from the deductible being $1,556 to $1,600, and then the daily co-share is kind of hitting more of a nicer number. Instead of $389, it's up to $400. Instead of $778, it's $800, and instead of the skilled nursing facility being $194.50, it's $200. Now, most people who are on a Medicare supplement plan will not have to worry about any of this. Also, if you're on a Medicare Advantage plan, your hospital copays are probably going to be somewhere in line with this. A lot of the plans that I talk about have like a 5 or 4 day copay where the total amount is anywhere between $1,500 and $1,800 total if you're in there for the entire 5 to 90 day period. So it is relatively the same for this benefit. So Part A didn't change too much. Part B, great benefits for everybody all across the board. And for Medicare Advantage members, a little bit of a boost. Now, what happens if you make too much money? So if you make too much money, then the Part B, they call it income related monthly adjustment amount, Irma. Get a nice picture here. So here is the Irma for Part B. So if you make less than $97,000 as an individual or $194,000 as a married couple filing your tax returns as of 2021, your premium will be $164.90. If you make greater than 97 but less than 123,000, there's your premium, and that's the monthly adjustment amount listed here, and then of course it goes up. This again is beneficial. It increased the first one, so 2022's number for the less than on the first table, so in order to not pay any more money for Medicare Part B, was $91,000. So the increase was a little less than, it looks like a little less than 7%, which is kind of like the core inflation rate. So it's in line with core inflation, so that's pretty good. I'm gonna say that that's a fair amount, so that people who made a little bit more money into 2021 do have a little bit more wiggle room to kind of play with before they have to pay the $65 per month increase on their Part B benefits. That's kind of it for what your Medicare premiums are going to be for 2023. If you have any questions about upcoming annual election period, any questions about your drug plan, any questions about your Medicare Advantage plan or Medicare Supplement plan, do send me an email. Let me know. If you have any questions or concerns about Medicare, also let me know. I'll see you in the next video.